My name is Leung. Today we will be discussing a global framework for panic disorder prevention and care and how this can help patients around the world. Just a brief introduction before we start. Again, my name is Leung and I will be a rising senior at University High School in Fresno, California. Things that I'm involved with include working in a neuroscience research lab for mental disorders, being a counselor for the California Youth Crisis Hotline, and co-leading my school's mental health club. I'm also very interested in mental health and hope to work as a psychiatrist or neuroscientist one day. Also in my neuroscience lab, I've worked on a project studying panic disorder, which is what sparked my interest and brings me here today. So in general, I will be going over the mental health framework for panic disorder, the global understanding and context, and ways we can improve care for panic disorder patients. First, what is panic disorder? Well, panic disorder is a mental health disorder where patients experience episodes of intense fear called panic attacks, which bring physical symptoms such as chest pain, rapid heart rate, shortness of breath, and so on. What does panic disorder look and feel like? It starts with panic attacks, which often consist of extreme physical and emotional symptoms. Physical symptoms can include rapid heart rate, muscle tightening, and choking sensations. Emotional symptoms can include overwhelming fear, detachment from reality, and a sense of hopelessness. These episodes are often triggered by emotionally striking events, and patients are frequently self-confined to their home because they are afraid of triggering an episode in public. This leads to social isolation, strained relationships, and lowered quality of life. So what is the global prevalence of panic disorder worldwide? According to the World Health Organization, panic disorder affects 2% of the world, or about 162 million people. Also, about 13% will have at least one panic attack during their lifetime, which means roughly 1 in 7 people. Bottom line, panic disorder is much more common than people realize. Panic disorder is also important from a global perspective because it is a significant contributor to healthcare costs. It was estimated at nearly $10 billion in 2023, but proper diagnosis and treatment not only mitigate these costs, but also reduce the risk of other comorbid and expensive mental health conditions. Plus, panic attacks are often mistaken for medical emergencies, such as heart attacks, adding costs for ineffective treatments in hospitals. Let's look at challenges for providing care for panic disorder. First, only about 1/3 of people who have clinical levels of panic attacks seek treatment in low to mid-income countries. This is significant because the 2/3 who aren't seeking treatment are likely developing comorbidities and other health problems as their disorder worsens. Second, panic disorder is often underdiagnosed or misdiagnosed as heart or respiratory conditions, preventing patients from receiving correct treatment. And finally, treatment affordability is also a major issue. About 40% of those diagnosed with panic disorder cannot afford therapy or medication. Let's look at options for each of these challenges. First, we can address the low number of people seeking treatment with more education and awareness. Second, we can improve diagnostic accuracy by using effective tools and standardized strategies. And third, we can lower the cost of therapy so patients can get better access to the help they need. Let's discuss these options in greater detail. First, to promote education and awareness for panic disorder, we can launch public awareness campaigns using mediums such as TV and social media. For mid to low income countries, nonprofits and governments can work to educate populations on the signs of panic disorder. Increased funding and resources can also go to workshops and public awareness campaigns. The benefits of awareness include reducing stigma, informing individuals to recognize panic disorder and thereby seek therapy or medication sooner. Improving the reach and engagement of the public will also help healthcare and mental health professionals who are on the front lines for identifying panic disorder. Next, improving diagnostic accuracy should also be a priority. Enhanced clinical training for health professionals or panic disorder symptoms is crucial for distinguishing it from other similar medical conditions. Standardized diagnostic tools like the Panic Disorder Severity Scale offer a reliable method to assess patients. I did a science fair project that used this specific scale and learned that this is one of the most reliable methods for diagnosis. Tools like this can help categorize symptoms, measure their frequency, and evaluate impact on daily life. Also, increasing screening for high-risk patients can significantly reduce underdiagnosis, ensuring timely and appropriate treatment. Lastly, we should aim to reduce therapy costs. This is especially true for the US, where therapy sessions are expensive and cost $182 on average. One way is to expand insurance coverage for mental health services. Another is to establish more free and sliding scale payment mental health centers. I've actually worked at one of these free centers, Sierra Meadows Behavioral Health, and witnessed the incredible impact in my local community. It's a free clinic where patients with mood, anxiety, and substance abuse disorder go to obtain no-cost therapy. Lower income regions especially need more places like Sierra Meadows that can give affordable care to those with panic disorder. Lastly, teletherapy is a relatively new and innovative option for more affordable care. Services such as BetterHelp, Ginger, and Talkspace cost about $60 to $90 per session. By lowering the cost barrier, we can significantly improve access to the care for individuals with panic disorder. To conclude, panic disorder is a serious mental health issue affecting millions worldwide. Proper treatment, including medication and therapy, is essential, but there are significant barriers to access. By embracing creative and innovative solutions, we can overcome some of these challenges. A public health approach can effectively raise awareness and improve diagnostic accuracy. Expanding teletherapy and establishing low-cost mental health centers will increase access to professional services, especially in developing countries. Education about panic disorder benefits not only patients, but also their families, communities, and healthcare providers, ultimately improving lives. Here are my references. I'd like to take the time to thank my family, mentors, and Dr. Bennett Leventhal for their guidance and continued support, to Johns Hopkins Global Health Leaders Conference for providing the wonderful opportunity to speak on this important topic, and to you, my audience, for your time and attention. Here is my email and LinkedIn info if you'd like to contact me. Otherwise, thank you again for listening.